Wonderful. All right, Dr. Vienna, thank you for joining us tonight to share your amazing protocols with us. I'm so excited you're here and going to be able to bring this to our community of light workers and practitioners and doctors around the globe. So without any further ado, I want you to go ahead and get started right away, because I know we do have, this is a setup for a question and answer. And so if you are on Facebook watching this, please make sure you're writing your questions in the comments. If you are joining us here on Zoom, please keep yourself muted and write your questions in the chat box. I'll be monitoring that so I can be able to help. And then at one point, I will be able to screen share here in just a minute as well. I'm going to get that available. So Dr. Vienna, would you like to go ahead and get started while I get that screen share set up for everybody?
Absolutely. Thank you. So what I'm excited about is something that we had talked about the last time I was on is, oftentimes we have clients or potential clients who are wanting to look into the LifeWave program, and then they get started on the patches and they don't see the results. And oftentimes there's things that are getting in the way, that are preventing the person from actually getting the full benefit from it. And so I had mentioned on the last podcast about there's a polarity test that you can do to see if their polarities are correct or if they're in alignment. And oftentimes when the polarity is off, they don't have the results, which also affects muscle testing. It affects everything. So, if you ever have any of those clients or friends or family that they're on a particular protocol and it's not working, oftentimes it's because something's out of order. And to test their polarities is such an easy thing that it can have a huge impact on the success of any kind of program, whether it's a nutrition, whether it's exercise, whether it's energy, whether it's any kind of intervention, but specifically patches. And so what I've started to implement with my clients or anybody who's interested in doing the LifeWave patching program is I do a polarity test on them first to see, are the polarities intact? And then I correct their polarities and then do muscle testing. And so some of the things that we're going to talk about today, and then I'm going to show you, if some of you are sitting and you can participate, I'd love for you to join in and follow me as we're doing it, because people learn best when they do the activity. Plus, there's a handout that I created that gives you specifically how to do this test and then how to correct it so that you can use that as a resource. In addition, I created another worksheet that actually basically takes all of the acupuncture points that we're using with LifeWave. Okay, maybe not all of them, but majority of them. I'm going to add to this list. It's going to be a continuing one, because as I was going through the protocol book, I was like, oh my gosh, I missed that one. I missed that one. So I'm going to add to it. But it's where do you find the point? So how do you find the forms of measurement so you can be very specific on your body where to locate that point to place the patch? And then what that point is good for. What are the indications for it? And then which patches are actually good for it as well. So it's a really nice cheat sheet for somebody who really doesn't know acupuncture points, doesn't really know what patches to use, what kind of conditions to use it for, that kind of thing. As well as, in addition, what the meridian stands for. There's a second sheet in there that will go through what the lung meridian is, what the pathway is, so that you can get a better understanding. And then in addition, there's two other handouts in there that are basically pictorials of the meridian system and some of the points that we use. So it's kind of identifying on the body where these points are located. There's two pictures of that will help quite a bit. So the first thing I want to talk about is, why are the polarities off? Now, in most situations, what causes the polarities to go off is typically exposure to EMF and 5G, radiation, if people have had x-rays, if they are on lots of different medications, if their diet is horrible, if they've got multiple medical complications, if they're medically complex, if they've had surgeries, if they're under a high amount of stress. So as you're going, okay, check, 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 you're thinking about all of these people that family members, friends, whomever, that are following that criteria. So if you think about, a lot of people are going to be in that criteria. Also, if most protocols that you put somebody on doesn't work, they have the opposite effect, that their polarity is probably off. So I'm going to show you how to do the polarity test and how to correct polarities, and then how to muscle test to find out which patch you should use for today, or patch is, and where is the best place for you to place that patch based on what your body is telling you. So it's going to be a muscle test to show which patch to use. And that way, because I hear a lot of my downline and people that I work with that say, there's so many patches, where do I put it? I'm running out of places to put the patch, or, you know, and so I want to be able to show you how your body can speak to you to tell you where and which patch you should use. But we have to correct the polarities first. So some basic information. The top of our head is a positive polarity. So positive here. The palm of our hand is a negative polarity. So if you know anything about negative and positives, you need a negative and a positive to attract each other. And if you have two positives and two negatives, they repel each other. So when we're doing this polarity test, you're looking to see which way does the body sway when you do this. So I'm going to stand up and I'm going to show you how to do it. Okay, so first you stand with your feet hip width apart, and your knees are nice and loose and all that. And then you're going to place your hand above your head about 4 to 6 inches with your palm facing your head. And you want to see and close your eyes and see which way does your body sway. Now, if you sway forward, then that means it's a positive response, meaning that that polarity is intact. Now, flip the hand over so that the palm is facing the roof, the ceiling, and then test again and close your eyes and see which way does your body sway. If you sway backwards, that's normal. So when the palm is facing towards the head and you sway forward, your polarities are intact. If you've put your hand up and you sway backwards, that means that it's intact as well. Now, if you get an opposite effect, meaning that when you put the hand above your head with the palm facing, and they either sway side to side, or they go backwards, or they go nowhere, they're kind of fascinating in place, then that polarity is off. Then if they go with the palm up and the same result, either they go forward or they go side to side or they spin, then that polarity is off as well. So the way to correct the polarity is you have to cross your midline, cross from one side to the other. And so the best way to do that is we're going to do some tapping first. So the first place you're going to tap, and you're going to tap this for 21 times. You're going to take 3 fingers and tap on the thymus gland for 21 times. So okay, then you're going to tap on the belly button 21 times. Then you're going to tap on the small intestine 3 point, which is called the karate chop point, what a lot of people will call it karate chop. And this, if you think about it, a lot of these points are used for emotional freedom technique. Okay, so tap 21 times here. Okay, it doesn't matter if it's left or right, if you're using your right hand or your left hand, it doesn't matter. Okay, so you can tap that 21 times. Then tap underneath your eyelid 21 times. But what I just did that wrong. Cross sides. So if you're using your right hand, you want to tap under the left eye. If you're using your left hand, tap under the right. I recommend you do both. Okay, so you're going to tap on both sides. Okay. Then the other way is, because the conception vessel, which we use a lot, it starts down the perineum. That's conception vessel 1. So the flow goes up the body. So you want to go reverse. So you're going to stroke down the body. Okay. So stroke from the very top all the way down. Okay, 3 times. Then the next thing you're going to do is you're going to take your 2 fingers and you're going to cross your forehead. So you're going to take your right hand and start with your left side and cross this way, and then cross this way. And you're going to do this 3 times. So you can go, shoo. That was hard. Okay. Then you're going to go cross from the shoulder, take your right hand to the left shoulder and cross the body all the way to the left hip. Take the left hand to the right shoulder, cross the body all the way to the right hip or left hip, and then do this 3 times. So right hand, left shoulder, right hip. Left shoulder, or left hand to right shoulder, left hip. So you can do that 3 times. Okay. And then you're going to retest your polarity. Now, it's just as simple as that. Now, you may have times where you're going to have to do this polarity reset 3, 4, 5 times, but you will get to that point where you are able to get them to that correct polarity. That's important. It happens that instantaneous. And then when you do this, their polarities are going to be intact. And then you can start to do some muscle testing. That muscle testing is important. We do muscle testing a lot. If the polarities are off, your muscle test is going to be wrong. And so you're going to get false information. So you get this right away. So then you go straight into muscle testing. Now, yes.
Vienna, do you want me to share? Do you want me to screen share that sheet that shows what you just
Sure.
did?
Absolutely.
Okay, hang on one second. Let me pull that up so everybody can see that. So this is a document that we'll be able to upload a PDF into the page. So this is what Vienna was talking about with checking your polarity, okay? And see the things we just did, those quick little, you know, the little kind of looks like.
Yeah, and the one thing I forgot was the silver spoon. So you can actually take a silver spoon at the bottom of your foot and draw a figure 8 at the bottom for about a minute on both feet. But you're going to do right hand to left foot, left hand to right foot. The whole idea is that you're crossing midline.
Yeah.
Okay.
Right. So, yep. So you'll be able to have access to this. Okay. So if you want to utilize this for yourself or in your practice with your clients, you can. Okay. Perfect. All right. Now,
and please feel free to share with anybody like in your downline or anybody that you feel really needs it, because this is such an important part when it comes to health. Obviously drinking lots of water as well, making sure you're getting your minerals and your magnesium in. Absolutely. I got mine as well. So that's important. Now that we have that, which patch are we going to use? So the best way you do this is that you take your, like I have my X39, and I'm going to, now that my polarities are in alignment, I'm going to hold this to my chest, and I'm going to say, all right. Oh, also, does everybody know how to do a muscle test? I'm going to show you how, if not. So the way I do a muscle test is I have somebody hold, I have them place their right hand on their heart and their left hand on their stomach. Their feet are within alignment of the hips. And then you say, you ask your body, show me a strong yes response. Okay, mine's going forward. Show me a strong no response. Okay, I'm going backward. Okay, so that tells me what's going on. Now I'm going to take my patch. I'm going to stick it on this is my X39. I'm going to stick it on my chest, or you can stick it anywhere you want, but I'm going to stick it on my chest, and I'm going to say, do I need this patch today? Okay, yes, I do. Okay, now I know I need this patch. Where am I going to place it? Do I need my patch here today? No. Do I need my patch here? Yes. Okay, so you can do this with all of your patches, and your body is not going to lie. So you go based on the yes response of where the patch needs to go. If you're swaying forward, that's a yes response. In most cases, that's how it is with most people, is they'll sway forward. Again, if your polarity is corrected, that should be the case. Some people will sway backward. Some people will go sideways, but it's really identifying what's their yes and no, and then going from that. So using that patch to identify it. So knowing that we have all of these wonderful little resources in our manual or our little booklets, as far as where to place these patches, for the people who are confused or like, oh, I have no idea where I should place this patch, have them muscle test and really ensure that they know how to do a muscle test on themselves. I have my clients go into restaurants or stores or whatever, and I have them muscle test their grocery list, and they're holding a cucumber to their stomach and they're saying, do I need this today? Yes. Or, that box of Cheerios, no. Or, that candy bar, no. And so I love it when I actually see my clients muscle testing themselves, because then I know that they're going to be eating food that is actually going to nourish them and actually, help create a wonderful environment for them. So if you want to bring up the other sheet, I'll kind of explain what that one is. That's the Excel one. So this was a labor of love for me. I love acupressure points, and I really like people understanding what point you're using for what reason. And I know that we have some limited resources as far as where to place the patches based on the booklets that we receive. So I wanted to be able to give some ideas of some other places that you could place the patches. And so what I did is I took the acupuncture point and gave the Chinese name for it, like lung one is middle palace. I like that because it kind of gives a little romantic view of what these points mean. And many of them make sense when you actually read what the name of the point is. And then the second column is where you find the point. Now, when we're talking about finding the points, there is a method of measurement. And in the tummy protocol, I listed that measure of the measurement. And so the width of your thumb is considered 1 body inch. The width of 2 fingers is 1.5 body inches. The width of 3 fingers is 2 body inches. And the width of 4 fingers is 3 body inches. So when it's saying 2 body inches or like 6 body inches, like in lung 1, it's saying 6 body inches lateral to the anterior midline of the first intercostal space. Basically, it's like right underneath the clavicle. And so you're basically measuring it from the sternum, which is the intercostal space, and you're taking your hand, which this, remember, the width of 4 fingers is 3 body inches. So you're basically taking the width of the width of 2 lengths of your hand, and you're going to find the spot there. So it makes it so much easier for you to locate it, and then you'll be a lot more accurate. I also listed some points in here that may not have been listed as protocols in any of our references, but ones that I've used in my practice for over 25 years that have been so significant in helping people overcome many things. So like, for example, large intestine 11 is a really good point to use for any kind of indigestion, digestion, diarrhea, constipation, that kind of thing. And so really identifying where to find that point. In some of the resources, I also listed what they mean, like when we're talking about proximal, distal, anterior, posterior, inferior, superior, what do those mean? So then that way, when it's telling you it's anterior to this, that means it's the front of the body, posterior is in the back. If it's proximal, it's the closest to the limb versus distal is the furthest away. So it's kind of, there's a definition of terms. And I think I might actually add this to this form too. I probably should put it at the bottom as a key to help a little bit, because then you don't have to go from one document to the other. I actually started this in a Word document and it ended up being way too big. So then I decided to put it in Excel. So I will update this with some of the additional points that I think I want to put in there. But then I noticed that people were not sure why they're using that point. So then I indicated what's the indication that you're using it for. So for example, kidney 3 is really good for headaches, blurry vision, dizziness, loss of consciousness, loss of voice, sore throat, dryness of the tongue. We use that one a lot. But also kidney 3 I use a lot also for pain, because it's a really good point for indicating a good indicator for pain issues, which is why LifeWave works really good on that one. So it's I think it's a pretty easy to use form. I would love feedback if there's some people that are looking at it and going, I'm so confused. Please give me feedback because I'd love to give it to you. Yeah. I don't hear you.
Mute myself. Sorry,
Okay.
this is the second sheet to that you have on
Yes.
meridians. Do you want to explain that one too before they ask questions?
Yes. So on the second sheet, so in the handout, you have 2 spreadsheets at the bottom. So you just have to click on the links at the bottom. And so the second one is about what are the meridians and what's the pathway of the meridian. So it says, okay, the lung starts here and it works down the side of the arm and it ends at the thumb. And so then you kind of get an idea of the pathway, where it's running. So when you're talking about polarities or, excess or deficiency, then, you can go against the meridian if you're trying to take away some of the energy because it's too acute, or you go with the meridian if you're needing to feed it. Also, how many points are in it, if it's a yin or a yang organ, meaning yin is a little cold, wet, yang tends to be hot. The yang tends to be more of a tubular, empty vessel, more like like the large intestine, the stomach, those tend to be yang, whereas the yin tends to be more of a solid organ. And then the time of day that these meridians are active. When I worked in nursing homes, I would use these times of day to work with some of the clients that were having issues. So like you notice that a lot of people have lung congestion at 3 to 5 in the morning. That's because that's when that meridian is the most active. And then what points you can use to inhibit the point, facilitate it, or if it's a master point. Master point means it's just a really strong, powerful point. And then what it's associated with. So what are some of the indications and what are some of the signs of excess or deficiency in that particular meridian? So it kind of gives you a little more information about what Chinese medicine is and how you can actually get to know what these meridians do and why. And so a lot of times when I'm talking about it, it's like, think about the meridian like it's a sprinkler system, where you have this piping and you have this energy that's flowing through it. And if you get a clog on either end, what's going to happen? You're going to get excess because that water's building up. And so we have to remove that clog. Whereas if it's flowing freely, it's going to open up. And so it's kind of identifying how they work and what's efficiency, what's deficiency and what's excess. So it's absolutely fascinating. And when you use this, you'll actually get a lot better results. So that's what this chart is. And then there's 2 other sheets in there that are basically just pictures of the body that shows where a lot of the points are located.
I don't see those sheets in there, Dr. Vienna.
Yeah, it was 2 PDFs probably in that thing that I sent you, but it's not in this one.
Okay.
Because this is more of an Excel. I couldn't save this one to PDF for some reason. I'll work on that one.
Yeah, because I don't see the other one and what you sent
Okay,
me.
that's okay. That's okay. But basically, they're pictures that basically show all the points that we put these patches on. So it kind of gives you a nice little look as, oh, okay, wow, look at how many places these patches can go on. It's pretty fascinating. So that's kind of what I wanted to talk about. If you wanted to open up for questions and answers, I know.
All of our minds just went poof.
I just really want people to be successful and to really love the LifeWave products because it is such an efficient and effective process if we just know the right point that we're putting it at. So when I hear people that are saying, oh, I get this itchy sensation or I get a burning sensation from the patch, it's probably on the wrong spot. And they just have to move it into the right direction. Each person is very different as far as where the points are. That's why we have this particular measuring system to identify it. And it's always using some form of a identifier, like large intestine 11. It's, one of the best points I like because it's great for, like I said, constipation and diarrhea. And it's where that crook of the arm is. You just follow that out, and right where that nice little pad is, that's where large intestine is. If it's painful to the touch, it needs to be treated. If it doesn't hurt, you're doing okay. So
wow, that's fantastic. Thank you, Dr. Vienna, for creating this. So
absolutely.
So Dr. Grizz asked if the information was going to be shared. Yes, I will share the forms here in the photobiomodulation page. Once we're finished, I'll upload them into the file section. So you'll be able to have those. Okay. So yeah, you can definitely ask any questions that you guys want. Now is time for your Q&A. That was just fantastic information.
I tried to go fast.
No, you did. It was I'm so grateful you created that. Wow.
Thank you.
Because I know there's so many people that, being in the field that we are with, practitioners and doctors, being able to have this as another tool in our toolbox, just like this book. But you guys know this book is fantastic. It was also created over 10 years ago, right? And so we know we've learned a lot since then, and there's a lot that we can share. So that is fantastic to be able to have this as a resource. So thank you, Dr. Vienna.
It's my Bible. I love that book.
Me too. Me too.
Yeah,
I know we've got
nice.
questions. So Lillian, did you have a question you wanted to ask?
Yes, I do. And first of all, I want to say I absolutely I've got it all tagged up because as I've been talking with my private clients, it's been amazing. And because I don't want to show that I've got an Eon patch on my forehead, I'm wearing it.
Show it proudly. Come on. Show it proudly.
I'm too vain.
Let it shine.
But I wanted to ask you because a private client of mine yesterday, I gave her X39 patches, and she's the daughter actually of a friend of mine who's over 21. And turns out she has IBS and she has some sort of other mysterious thing that's going on. She actually went to the hospital. They sent her back home because they had all these drug overdose cases and so forth. But then
Wow.
as I started to talk to her yesterday, she's starting to reveal to me that she's been suffering with IBS since she was 13, 14 years old. So this is a chronic situation. So when I was following up with her today, she's drinking 120 to 150 fluid ounces of water, which is excellent. She slept the best that she's ever slept because she applied the X39. I dropped it off to her about 7 o'clock last night. And so when I was following up with her today, she revealed to me that she also is suffering pancreatitis. And this girl is not even 30 years old. I'm like, whoa. So she's got a lot of inflammation. She's got a lot of mitochondrial dysregulation. I'm starting to get a more clear picture of what's going on here. So my question to you is this. I had her put the X39 on the governing vessel on C7, which is, we always talk about either the C7 or the triple warmer 3, about 2-3 inches below the belly button. But for her, I had her put it on there. My question to you is this. Do you think it would be more advisable, because she's suffering from the irritable bowel syndrome and the pancreatitis, it's all, in the gut. Do you think it would be more advisable, instead of that C7, to put it maybe on the acupressure point, the GD11 that you were, not GD, the acupressure point 11 that you were talking about earlier?
LI11, yes.
Okay.
Yes. Yeah.
So let me.
You could also have her apply it on the conception vessel. You're talking about the governing vessel back here, right?
The GD vessel, yeah.
Yeah, that's
exactly.
No, that's governing vessel.
Yeah, governing vessel, which is C7.
14.
Yeah.
No.
Exactly.
Yeah, on the C7 part. When you say
Yeah.
C7, it also sounds like it's also the conception vessel. So.
Oh, no. I meant
Yeah.
cervical instead of 5, 6, 7.
Yeah.
Vessel 14. Yes.
So you could actually have her apply the X39 on the tummy as well, because that's also going to help with the digestion, if you think about it. Okay.
Yeah.
Now, I also want to make a point. So governing vessel, if you think about governing vessel, governs the body. Okay. So anything related to neurological brain balancing, like Parkinson's, strokes, back pain issues, governing vessel is always going to be the one you go to. Conception vessel, think about conception. Conception is reproductive. So anything related to hormones, anything related to the digestion, but also, given that she started this so young, I want to know what the emotion is behind things.
Yes.
What's the trauma? Where's her trauma?
So we're again right there. So when she told me, well, she had the best night's sleep ever. Last night, she said she had this fantastic, awesome dream. And then at the end, the dream didn't end well, but she said, first of all, she slept deeper, sounder than has in years. And even though the dream was all fantastic, it had a sour ending, but she said it was still a fantastic dream. So I said, okay, go back to the feeling that you had that was unpleasant at the end of the dream. And in this 3D plane, tell me, when was the last time that you had that same thought, feeling, or emotion come up, that same sensation of whatever it was that you felt in the dream? And report back to me, what are you aware of? And it could be in the recent past, or it may have been, a while back. And she said, oh, it's my sister here at home. I have that same feeling every day, every time she comes home from work. And I said, really? She goes, oh, did I tell you about my cut eye? I said, no. What do you mean about?
She's unveiling. Yeah.
Yeah. So then she revealed to me that basically her sister physically abused her, cut her eye, yada, yada. The police came. Yep. There's some emotional stuff that's going on. So,
well, that kind of makes sense. I'm going to interrupt you for a moment. The gallbladder, meridian goes right around the eye. So that kind of makes sense with that trauma to the eye. There's a lot of emotion connected to that, which of course then it's going to affect the gallbladder, which has a lot to do with fat, digestion and processing. So I would actually recommend that she actually goes on to a really good kidney or liver cleanse and clean out those organs, because that's what's going to help things move. Get her on an alkaline diet, see if she's acidic. I have a feeling she's very acidic.
Oh, very. I told her today now knowing about the pancreatitis and so forth, and now that I know that she has IBS, I said, listen, you need to take 4 to 6 ounces of water with half a teaspoon of baking soda, warm water, and drink it. Don't chug it down, just drink it smoothly. And then before you go to bed tonight, if you feel you have, and if you're not sure, it's like what feels lighter, what feels darker or heavier. If it feels lighter, to drink the water again before you go to bed, then drink the water again with the half teaspoon of baking soda, because that's going to help not only alkalize your body and reduce the inflammation, but it's going to help stimulate a bowel movement. So I recommended that, as well as I said, not today, because you're doing these things today. Tomorrow, I want you to go ahead, go to Sprouts, get organic moringa, and have moringa tea first thing in the morning. So I explained to her the benefits of that. I sent her there's like 2 documentaries, one from the Discovery Channel and another one that's shorter, to let her know what the benefits are of that. And then, yeah, those are the 2 main things that
I would also suggest that she does a little bit of forgiveness. So have her go through the Ho'oponopono meditation and do some forgiveness of her sister.
Okay.
Because unless there's forgiveness, and it's not necessarily she's forgiving the abuse, but she's forgiving it so it doesn't harm her anymore. So have her go through that meditation so that she can actually heal the trauma, because it's always going to stay there if she doesn't.
Yeah, we don't want it to be lodged in her body. My
Nope.
last question.
Yeah.
My last question to you is, are you familiar with the Hilda Clark cleanse?
Yes.
Okay. Love that cleanse.
Yes.
I think it's too much to have her do right this second.
Yeah.
But in a few days, I'm gonna, muscle test her, and I'll tap into her autonomic nervous system, see where she's at. And I think it's possible that she might be open and ready for that this weekend, because today she's already feeling a little bit better. She still has a ways to go, obviously. So I would say she's probably 24, 25 years old. She's such a young girl to be going. I can't believe she has pancreatitis and IBS for over 10 years now. There's
emotion in there. A lot of emotion that's making it that way.
Yeah, and her father died of cancer when she was a baby. She barely knew him. She was like 2 years old when he passed. So there's a lot of stuff kind of going on there. So, but okay, so I'm gonna have her do the Ho'oponopono. I had not thought of that.
That's an amazing meditation. I get a lot of people to do it because it's so profound.
Okay. I really appreciate that. I can't wait to listen to this replay and to get my hands on the digital assets that you shared with us here. So thank you so much, Dr. Vienna. I really appreciate you.
Absolutely. And I'd love to have any feedback as well. If there's any ways to improve it as well. I have no ego with it when it comes to that.
Fantastic. Thank you. Love you.
Okay. I love you too. Thanks.
All right. Bye.
Thank you, Dr. Vienna. I have somebody that has a question on the Facebook page. They said, what if somebody taps more than 21 times?
That's okay. I like 21 times because 21 is a really magical number for me. But also it's a really good energetic number. So it doesn't matter. They need to get at least 21.
Okay.
Yeah.
But it's okay.
That's okay.
Go over.
Yeah. Yeah. Okay, if they're a little overactive, that's fine.
Perfect. Awesome. I love it. What other questions do you guys have? You can type them in the chat, or you can just raise your hand, start talking.
I have a question.
Yeah.
Okay.
There I am. Okay. I had to go in and out. I lost the signal a little bit, but did you cover the biomodulation, the photobiomodulation? And could you go into that a little bit more deeper, or did you already cover that?
I did.
Of how the patch actually works.
Okay. So I want you to think about the way in which the sun interacts with our skin. As soon as we go out into the sun, it starts to manufacture vitamin D. And so we are rays of light. If you were to do a GDV, you'll see all this wonderful light coming from our bodies. And we have these patches that within this patch are like, amino acids, crystals, that kind of thing. And when it attaches to the skin, the warmth of your skin then activates those crystals, or what's, the organic materials that are in there. And then it encourages our own body to release the glutathione. like the glutathione, the carnosine, all that, it helps to release that within the body. Similar to the way the stem cells are. So when it is attached to the body, the heat from our body then stimulates the light rays that are emanating from us, and then it activates the patch to then release the stem cells, our own stem cells, which I love that, because a lot of people will go to get stem cell injections. We don't know where those stem cells come from. And so then they're having this stem cell that could be coming from a very, dysfunctional or whatever, but then it'll also interact with our own stem cells. So I like the fact that we're generating our own stem cells. Does that help answer your question?
That was beautifully said. Thank you so much.
You're welcome.
And I finally made it home. Yay.
Yay. And I'm glad you stopped to use the phone. That was good.
I just pulled in my driveway. So thank you so much. I really enjoyed those sheets. I can't wait to look at them further as a practitioner. And then also to help explain that to clients. That is going to be so helpful, is like, well, how much, well, it's not my measurement, it's your measurement by your body, which makes it so accurate.
Absolutely.
And that's a beautiful thing, you
yes.
know. So thank you for taking the time to develop that. I really appreciate that.
You're welcome. It's something I used to teach when I was working as an occupational therapist. So it's kind of getting back to my roots, and I'm loving it. I love it. Great
Wonderful.
topic.
Yeah. Thanks so much. Good to see you.
You're welcome. Good to see you too.
Dr. Vienna, someone said, can you tell me what patches you recommend for a diabetic with neuropathy?
Oh, well, first of all, LifeWave. I love LifeWave. I always like to use the X39. I use the Eon. And then I also like the carnosine for that one. Glutathione, I use pretty much every day. We all need glutathione. So those are what I use. And depending on where you patch. So I actually had one of my downline, she was kind of like, oh, I'm not sure this is actually working, blah, blah, blah. And then she messages me and she goes, oh my gosh, I just realized my diabetic neuropathy is gone. So like, sweet. So one of the ways in which I support my people is I will first of all, do the polarity test, see how they're doing. And then I would recommend certain areas. I actually have a little spreadsheet. I'm such a Capricorn. I have a spreadsheet that I have all my downlines on, and what their main issues were that they wanted to patch themselves for, and which patches that they got, and then what protocol I'm recommending for them to put on it. And then I follow up with them after they've tried that to see if it's actually working. And then that's when I know they're getting the right support from me, as well as that they're learning at the same time how to use the patches and the flexibility that you have with it. So those are the ones that I would recommend. Energy enhancer as well, if they're having some issues with brain fog, which tends to happen with diabetes. And then I would also use spleen 6, because the spleen 6 is also helping to manage the actual blood sugars on top of it. So that's a lot of patches, but hey, we got lots of places to put them. Also, most people don't know you can actually stack the patches. And what that means is, like, we have the X39 and the Eon that go in the same place. And I believe it's also the Alavita go in the same locations. And so you're like, okay, 3 patches I want to wear, but I only got 2 spots. You can actually stack the patches on top of each other and they still work. Okay.
Yeah, a lot of protocols in our book actually require you to stack a patch on top of another patch.
Yeah, the brain balancing one, you're stacking 3. You're stacking the 3 age ones on top of each other on the top of the head here, which is a really that's a great spot. So
fantastic. Thank you. What other questions do you guys have? We have a few more minutes before we have to hop off here. So please ask your questions now. I'm looking the page one more time to see if you're any there, but if you guys want to unmute yourself or type your question in the chat.
And in addition, if you guys have some topics that you'd like to have covered, especially when it comes to acupuncture points, traditional Chinese medicine, any of those kinds of things, let us know. I love to educate, so I would love to be able to help with that.
Is it okay to put a patch on your head if you have hair, Dr. Vienna?
Yes. They're even saying that you could put the patch over clothing. So yes, you can do that. If you want it to stick, like I have a few men who have very hairy backs. I usually just try to shave that little area so it'll stick really good. So, but yes, you can.
Or you can also, if it's for your head, if you want to put it up here, you can also put it on the inside of like a beanie or a hat.
Yeah, or you can also wear a hat so it kind of stays in place.
Mm-hmm.
Mhm. And you know what? I wear my patch proudly. So the way in which, I mean, we're always talking about how can we grow this business, but really it's about how can we help more people. And so I always like to wear my glutathione patch right here. I wear it proudly because then somebody will say, "Ooh, what's that patch for?" Well, let me tell you. And then I start to tell them what it's all about. And that's where they get really, they get excited. Yes, it's safe to wear the patches for a pregnant person. When it comes to the acupuncture points, there are some points that you do want to avoid for a pregnant person. And that would be the large intestine meridian, especially large intestine 4, large intestine 11, and large intestine 10. Those will actually, if you palpate them and you actually do some pressure or you do some intervention with it, that could actually cause pre-labor. So you do want to avoid the large intestine for that part. To put a patch there wouldn't be bad. It's only if you're applying the pressure. I think there's better points to use for pregnancy than the large intestine point, so I wouldn't use those. Just avoid the large intestine for any pregnancy.
That's good to know. That's
Yes.
really good to know.
Yes. Yes. Mm-hmm.
What about for dogs?
Oh, dogs. You mean pregnant dogs or
Just
using them on
dogs.
dogs? Okay.
Dogs.
Yes, absolutely. The back of the collar is a really good place to place the patch, or like right under here, kind of where the thymus gland would be, to where they can't lick it off, they can't suck it off or whatever. If they wear a collar, you can just apply it underneath the collar. So then that way it kind of stays intact and it doesn't, move. I actually take my used patches like my X39 and after my 12-hour use, I'll stick it on my animal, my dog. She's a beautiful chocolate lab and it still works really well for that.
Fast.
Yes, there are patches for libido. Hello. So if you look on the spreadsheet, you'll see some really good acupuncture points that you can use for libido. A lot of those are going to be on the conception vessel because conception vessel has to do with conceiving and, reproductive and all that kind of stuff. So some really good points are located there that you can actually use for that.
Fantastic. So what I have heard from people's testimonials are definitely the X39 and carnosine.
Yes.
Those are the two patches that I have heard men specifically speak about on testimonial calls.
Yes. Also Nirvana. Yeah, baby.
Yeah,
it gets the mood. Hello. And also, there's some really good points for mental health issues as well that I've listed on the spreadsheet that many people are dealing with. And so you could use the Nirvana point on a lot of those points, as well as the X39, or not the X39, but the Eon, and also the carnosine one.
Fantastic. I love it.
Yes.
Any other questions? Anything else before we hop off here this evening? Lillian?
I have a question. When you were talking about stacking the patches, I've been stacking them this way, and I wanted to see if this is okay. I just put it's X39, X49, and then this is an Eon patch. So is that advisable? Because it's all still in the governing vessel 13, 14, 15.
Yeah, you can still do that.
Yeah, David calls it kissing the patches.
So this is kissing the patches or putting them on top of each other's kissing?
That's called kissing.
Yes.
We were talking about a minute ago was called stacking.
Okay. I just want
so stacking is you're putting it right on top of each other.
Okay.
Okay. Whereas the kissing is, hello. Yeah. Yes. And I like that. I like the fact that they're calling that a kissing. It makes sense.
A couple things else in the chat, Dr. Vienna. So somebody said they may have missed when you spoke about this, but I only slept good with Silent Night patch a couple nights and then it stopped working. Yeah. So you switch your points. If it didn't work, then you just switch them out. Now, remember, do the muscle test. Find out where you want to place that point or the patch. So if it only worked for 2 days, try it in a different location and say, does my body need this here today? Or like where most of the Silent Night patches go, place it there and say, do I need to put it here? Also, you can go to the acupuncture points that indicate insomnia and you can place them there.
just keep in mind that you're going to use both sides of the body. So you're going to put the white one on the right and the tan one on the left. So you're going to use some of the insomnia points for that. So you can go to that sheet and look up insomnia and place the patches there. I created that sheet so you had more to work with outside of the brochures that we had, as well as outside of the wonderful manual that we have.
Perfect. Thank you.
Yeah,
All
you're
right.
welcome.
Somebody said, have you heard of anything in regards to patches helping with being able to get pregnant? I personally have heard David say that a million times. When people say, can you use this on pregnant moms or children? He says, well, we haven't done clinical studies on them, but boy, we sure have seen a lot of people get pregnant.
Yes. We're seeing a lot more infertility issues going on. I think because of some interventions that have been occurring. And so, yes, these patches will help a great deal with infertility. I would use a lot of the conception vessel points, as well as the spleen 6 point is a good one. The spleen 6 is fabulous for hormone issues, stabilizing hormones, as well as for appetite. And it's also a really good one for pain. Now, the thing when you're looking at meridians, think about what is the function of the organ and where does the meridian go through. That's why I really wanted to show you the pathway where the meridian goes through. So knowing that the lung starts at the, underneath the clavicle, and then it moves up and then it goes down the front of the arm and it ends at the thumb. So you can think about the path. First of all, what does the lung do? It's for respiration, it's oxygenation, it's, clearing things out. So if they have phlegm, if they have mucus, if they have all that, you can use the lung meridian for that. But then also, where's the path run through? So knowing that it starts here, goes up and then into the shoulder, and goes into the anterior part of the arm, and then ends at the thumb, then you can say, okay, do I have pain along this area? Then yes, you can use it on the lung. So lung 7 is a really good one that is used for lots of respiratory issues, things like that. But also think about arthritis. It hits right there in the wrist crease. So that would be a good one to use as well. So you'll also be able to find these acupuncture points. When you're, this is really what I really like to do, is actually feeling the point. So when you locate the point, you're using your measurement. This is your 1 body inch, 1.5 body inches, 2 body inches, and 3 body inches. So when you actually find the point on your body, feel a little deeper, and you'll feel a little divot under the skin, because the acupuncture point is just right under the surface of the skin. And the reason they can't find it in autopsies is because of the fact that the person's dead. And you need energy for the point to be, identified and to be accessed. So if there's no life in the body, there's no life in the point. But you can actually find the point, and you'll, you kind of have like a meridian party, let's find our meridians and let's find our points, and you just start to track it. So you start from the top and you start to find all the points. And then that's how you could get to be very familiar with where the points are. And then as you're palpating it, if there's a painful point, you should probably treat it. So with the one with this insomnia, pick some of those points. If it's painful to the touch, use it. It's going to help.
Fantastic. Okay. Thank you. All right.
You're
Somebody asked if there's anything for stuttering.
Ooh, that one, I would use the voice protocol. There's some points in there for voice. I would think there's a lot of them in the conception vessel. So I would look at that. I don't have my book to look at right now, but I do believe there is one. But if there isn't one, go on the page. I know that I listed some points for voice, and that would be a good one.
I don't see voice in here, so we'll definitely have to look at that page. Thank you. And then somebody else asked, have you heard of anyone that was actually in menopause for over a year after years of perimenopause and PCOS actually starting their cycles again?
Yeah. Yes. Okay. So this is really kind of a interesting story. I have a lady that I do remote biofeedback with in Indiana. And she called me in a panic saying, I started my period. She said, well, I'm bleeding vaginally. And I said, really? And she's thinking it's cancer. I said, go get it checked out. And she came back and said, you're not going to believe this. And I said, what? And she goes, I started my period. And she's been in menopause. I mean, she's postmenopausal and hasn't, been in menopause for a long time. I said, what changed? And she said, well, let's see. Well, she had the vaccine. and she got, both vaccines and the booster. And I'm seeing a lot of people that are actually having that happen as a result of that. So yes, it is possible. Also, I have been talking to several veterinarians where their little puppies are coming in at 6 weeks and they are in heat. And normal time is 6 months. And she looked at everything to find out what was wrong and found out that the owners who had the vaccine, they every single one of them, the owners had vaccines. And so it's turning their little puppies into fertility man. Unfortunately, if they were to get pregnant, it could probably kill them because their system is just not ready.
Wow.
So that was the only known commonality.
Wow.
Mm-hmm.
Okay, so she said she was wondering more in reference to soon after starting the patches, not vaccinated.
Okay, so you're not vaccinated, but you did start your period.
That's what she's saying. She was wondering in reference to soon after starting the patches, after being in menopause for over a year, would you start again?
Oh, no, you wouldn't. If anything, it should actually help your menopause. I mean, if are you still having menopausal symptoms? And if
No,
not,
she's
you'll be
not
fine.
having any symptoms. She actually started patching and started a period again.
Okay.
So on the other side of menopause, and then goes back to,
okay,
now I'm having a period.
Yeah. So oftentimes the blood becomes stagnant, and especially when we go into menopause. And so that stagnancy actually kind of tricks the hormonal system into thinking that you're going into menopause. And so sometimes, like I've gone to a traditional Chinese practitioner and she says, you must bleed, because I was on birth control. And so I took myself off birth control and I did have my first like really big bleed. And then I went into menopause and it actually relieved that. But it's probably because you've had stagnated blood and you needed to release it. I'm wondering if you were having some symptoms associated with the postmenopausal that could be determining that you're having some blood stagnation. The way you can tell is if you were to go to spleen 6 and you press on it, if it's extremely painful, you probably have some blood stagnation going on, because spleen 6 is a good one to test for that one.
Fantastic. Wonderful. Wow. My mind is blown. I've learned so much tonight. I took a lot of notes here. So thank you,
Awesome.
Dr. Vienna. Wow. I'm going to upload those. Of course, I'll save this recording. I'll get it uploaded. I have another Zoom in 5 minutes. So once I have that Zoom done, I'll upload this recording. I'll upload the documents into the file tab, or Dr. Mel may be able to upload them as well too. And we will definitely get this information out to you guys. So wow. Thank you from the bottom of our hearts for all of your knowledge, all of your information, and share and taking the time to do this for everyone. It's just greatly appreciated. So
I'm happy to do it. I just want everybody to be successful in this program and spreading the wealth and the health with everybody. There's a patch for that.
Yes, there is.
Yes.
Thank you. Thank you. Thank you. Appreciate